Hello and welcome to India Top Doctors Health Dialogue. Cancer is a huge threat to human beings around the world. The incidence of cancer keeps increasing with more and more people being diagnosed with the disease. The Indian census data indicates that the rate of cancer mortality is one of the highest in the world. Cancer has emerged as the second most common disease in India. This is mostly because of lesser awareness about the prevention, diagnosis, and treatment options available. Therefore, to provide more information on this, today we are going to invite Dr. Pooja Nandwani Patel. Dr. Pooja is a radiation oncologist, head of department at Sterling Hospital, Ahmedabad, and has an experience of 15 years of working in the services of needy people. So please welcome her. Welcome to India Top Doctors Health Dialogue. We are talking about cancer today, how to prevent it and aware about it. So before we move any further, can you tell us about yourself?
Hello, everyone. So I am Dr. Pooja Nandwani Patel. I am a cancer specialist, and to be more specific, I'm a radiation expert. As we are all aware that the cancer treatment comprises of three main things, that is the surgery, chemotherapy, and radiation. So radiation is my field of expert, and I'm a radiation oncologist practicing since more than 2 decades. And I'm very glad here to be on this platform so that we can share knowledge, because being a clinician, it's our primary job to treat, but I'm always very happy to be there on the society platform and, to create more awareness regarding this disease.
Okay, so you said you are a cancer radiation specialist. So can you tell us what is cancer radiation?
So first we need to understand what is cancer basically. I think language is English and Hindi, right?
It's English, but
okay, fine. Okay, fine.
Yeah,
that's fine. No, I just want. Okay, fine. So what is cancer? First, we'll understand that. We know that our body is made up of millions of cells, and each of these cells, they have a typical pattern of growth and dying. But certain times, what happens is certain cells, they become uncontrolled. They keep on growing and keep on growing, and they don't die. So if any of the cell is multiplying and there's an uncontrolled growth, that probably leads to cancer. Now, when I say cancer, and as I mentioned before, that there are three scientific treatments. Apart from people do all these type of herbal treatments and other non-scientific things, but if you go through the literature or go through the science, it says radiation, surgery, and chemotherapy. And when I say radiation, so we need to understand, because this is a branch which still has a lot of confusion and myths in the society. Radiation is a type of X-rays what we use for the treatment purpose. It's like what we do in CT scan or a simple X-ray. But usually there, the X-rays have a low voltage, so they are just used for the diagnosis purpose. But here, in my field, these voltage, they are high voltage X-rays. So they actually kill the cell, and that is why they are used for the treatment purpose. So radiation is a branch where high voltage X-rays are used to kill a cell and thereby cure the cancer disease.
Okay, so doctor, at what age of the cancer is patient recommended for radiation therapy?
So I would say this, that it's not like what stage, it depends upon first what site it is. So radiation is used in different ways. It can be like, let me give you example why, so you will understand better. If we are giving radiation to cure the disease, now there are certain areas where, suppose say cancer of the voice box. So initially, long back, what we used to do is surgery. So that used to remove the whole voice box, and the patient will not be able to speak anytime in the life. Then there were more science and more research onto this, and then we realized that even radiation can cure if it's early stage voice box cancer. So in these settings where we are intending to treat the disease only by radiation, that is called a curative radiation. Sometimes we can give it with concurrent chemotherapy, which is again a different sort of treatment where we give injections. These are some high dose injections which again cause the cell kill. Another radiation where it is used is where we sometimes downstage the disease before giving any other sort of treatment, like for example esophageal cancer or rectal tumors. There Now the guidelines have changed. We don't operate it upfront. We first go for pre-operative radiation so that we decrease the tumor size, and then we go for surgery. So there, the radiation is used in the pre-operative setting. Then sometimes what happens is, like majorly in breast or head and neck, we operate first. And then with the histopatho report, we realize that the disease is a little bit aggressive. It can come back. So in order to prevent the disease coming back, we give radiation, which is known as post-operative radiation therapy. And the another last form of giving radiation is known as palliative radiation. It means sometimes we know that despite we all talk about this, many of the times patients present in advanced stage and we cannot completely cure. So in those circumstances, we just try to give a short radiation therapy so that we can make the patient have a little bit symptom-free life. Like if the patient is having bleeding or pain or has any cord compression features. So there a short radiation therapy is given so that the patient can be symptom-free for the whatever amount of life he has. So it is according to the intention of the treatment, whether we are going for a curative setting or a post-operative or a pre-operative or a palliative, the radiation protocol is decided. So it can be anything right from stage 1 to stage 4.
Okay, so talking about radiation therapy, can you tell me the difference between external beam radiation therapy and internal radiation therapy?
Wonderful. So what happens is, as the name itself says, external means the machine is away from the patient's body. So it's like a CT scan machine, a very big CT scan, very advanced sort of machine, where the patient lies on it. And then from the machine, the X-rays will be coming out and they will be entering the patient's body, and there, whatever area we'll be targeting or focusing, there the radiation will be given. So that is called an external beam radiation therapy. Another form of radiation therapy is we put some radioactive sources inside the patient's body, and then the radiation is delivered. So it's like a very short form of radiation therapy. Like in the CS cervix, we do some intracavitary, we put some applicators, we connect it to the machine, and then the radiation is given. So there's a radioactive source involved in this, and this is called internal radiation therapy. Most commonly, these type of treatments are used in cervix or sometimes in esophageal cancers, where we pass a tube through the esophagus through the food pipe, and then it is again connected to a machine. So that's called a brachytherapy or an internal radiation therapy.
So this is really very effective. So can you tell me to what extent is radiation therapy effective? Which patients should not get radiation therapy? Is there any differences when it comes to
So I would put it like this, as I mentioned before, that radiation is given according to the intention, like curative, palliative, and pre-operative and post-operative. But sometimes, when I said very advanced cases are there, like for example, if it's a CS cervix, what happens is in a case of cervix, which is the lowermost part of the uterus. This uterus, in front of there is the bladder, and behind is the rectum. Sometimes the disease is so advanced that probably there is a very thin layer formed between the cervix and the bladder, or the cervix and the rectum. And probably the disease is so big, if I give radiation to that, probably that one layer which is there will be broken and it will form a way. So we call it in a scientific language as fistula. Means it will be a one-to-one whole connection. So in those circumstances, probably giving radiation will be more miserable to the patient. So there are certain situations where probably we would say that don't want to give radiation, or sometimes there are colon cancers. The colon, so the main problem with the colon cancers is these colon, they are the intestine I'm talking about, they are very mobile. So we can't trace it daily, because this radiation therapy is not just a one-day treatment. It happens for weeks, some depending upon what dose it is. So we may give it for about, say, 1 week to about 6 weeks also. So if the patient has to come daily, then it is very difficult to trace the colon or the intestines, which are quite mobile. So there probably our intention of cure may lead to more harm rather than benefit. So such circumstances, probably as a radiation person, still we would try to step back and say, no, radiation is not required.
So we have heard that radiation therapy, for some people, it's a myth that it's not safe to get radiation therapy. So is it true?
No. So there's a basic, very common thing. People usually come and ask me that I have children at home, I have a pregnant lady at home, I have elderlies at home. So will it be safe if I go for radiation therapy? Will I be emitting radiation to them when I go back home? So this is a very nice question which people has to understand, that radiation, as I said, when the patient is on the machine and the machine is delivering the radiation, that X-rays are entering from one part of the body. It enters the body, and whatever area we have targeted, it will give radiation there, and the rays will come out from the other part of the body, which means the radiation does not stay in the body, which means when the patient is out of the room, he or she is like us. He or she is not emitting radiation. It's very safe. It's not any contraindication or inhibition that patient can, if go home, can be dangerous to others as it will be giving radiation. No, it's not like that. And one more important thing, because you highlighted this question, I would like to say people have this type of confusion that it's a cancer, so we should not be eating in the same plate, we should not be sharing the bed. That is also not true, because it is not a communicable disease. This is not an infectious disease. In fact, I would say this disease, whenever a patient is going through it, it requires a lot of mental support and a family support. So people should be more generous and more giving family support and love to the patient. And these type of differentiation that, since he or she is diagnosed with cancer, I will not be sitting in the same room, or will not be sitting on the same bed, or will not eat from the same plate, should not be done, because this is has no scientific background. There is no logic behind it.
The answer was really a great mythbuster, I guess.
Yes.
So you are a radiation specialist. Can you tell me what is the biggest issue faced by radiation oncology?
So I would say radiation is a very integral treatment in the cancer disease. As I said, there are different methods. It is always a multidisciplinary team approach. But still, in fact, yesterday we had the World Cancer Day. And there was a very important statement coming from the international agencies saying that still there are a lot of countries which don't have enough radiation machines. So, or even if you see the situation of any major city also, like if I talk about Ahmedabad, when I did my residency, probably it was just the civil hospital which had the radiation machine in Ahmedabad. Then probably when I finished my MD, I think one of the corporate hospital first came with radiation. But so it is very difficult that if you are not staying in Ahmedabad, if you are staying in Baroda, Surat, Rajkot, it is difficult for the patient, because as I said, this is not a one-day treatment. So, but now, of course, gradually all the new cities have also come with radiation machine. But still, I would say, as per the demand and the supply ratio, still we don't have that much adequate radiation machines, and ultimately this affects both the patient, because he is not having the cancer services or the cancer treatment accessible at his or her home place, so he has to travel. Or maybe if the radiation machines are not very advanced, again, if it's a very complicated tumor, he may need advanced treatment, so he has to come down to Ahmedabad or go to a major city like a Mumbai or Delhi. And secondly, as a radiation oncologist, it is difficult for us also, because everybody, of course, we want to be a good clinician, but we want jobs also. If after passing our degree, if we don't get adequate jobs, then probably this will lead to a more pessimistic attitude in the fraternity, that let's not take radiation because there are not enough machines. We will not be secure also that we will get job or not. So I think this, and of course, this problem has already been addressed by the many important national and international forums. And I'm sure with coming time, there'll be more and more machines, so that even the patient is getting the benefit at his home place. He gets the best services, best radiation services, and even everybody is getting a good job.
Okay, so I know that you have a great experience in this field. Can you tell me that how would you handle a situation where a patient is experiencing any kind of side effect due to radiation therapy?
So this is a very common situation. There are very two common situations which we see in our daily clinical practice. Like I had just a patient before. First is the fear from the disease, the fear from the disease, from the treatment. Like this patient I just saw 15-20 minutes before was a CA breast, and cancer breast. She has completed her surgery and chemotherapy and is now coming with the radiation. So she has a lot of fear about the treatment, which I could counsel her, and she has agreed for the treatment. But this is one fear that people really fear from the treatment, and about the side effects also, because एक तो जैसे मैंने बताया कि this disease is itself is a very big name in, and it creates a lot of fear in the patients and the families mind that ab kya hoga, what will be the next. And then when you talk about the successive treatments like radiation, still it is not being known in everybody's mind, so they have a lot of questions and doubts. But yes, with advanced radiation machines, I always keep on counseling my patients that the radiation treatment has also become very safe. There are not many side effects. And if at all there are some certain side effects which are happening, we have to understand if there is any effect which is happening, there is bound to have some sort of side effects. But with advanced machines and with good medications, we can give a good counseling to the patient. We can give a good external support and can help the patient complete the treatment.
All right. So I know for a fact that we have few restrictions before we go through any therapy or any kind of such things. So can you tell me, are there any restrictions before or after even the therapy?
So I would say I'm very proud to say that my radiation treatment is very safe treatment. It does not have very hard restrictions or very hard instructions also for the patient, because like if I would say, like, for example, I'm saying this example of the recent patient, the carcinoma breast. When the patient is on chemotherapy, sometimes they advise not to take fresh fruits and vegetables because they have fear that the patient's immunity is going to be down. And if by chance the patient is not properly washing the vegetables and the fruits, it can lead to infection, which a normal person would not. So they advise that even if you want to have an apple, you can get it first boiled and then have it. But in radiation, it is not such a problem. The immunity is not an issue. So there are no hard restrictions on diet. But yes, we definitely ask the patient to take a less oily and less spicy food. We have to understand one important fact is there's a big difference between radiation and chemotherapy. Radiation is a local treatment. This means wherever I'm going to give the treatment, only that part will be affected. It's not like chemotherapy, which is given through the veins and it acts on the whole body. So if I'm going to treat a carcinoma breast patient, probably her breast or her chest wall is my target area. So we just want that area should be untouched as much as possible. So we ask the patient to wear loose clothes, cotton clothes. Do not apply anything on the skin because logic is very simple. If you apply any lotion or perfume or deodorant or soap, there will be a one layer of chemical which will be formed, and then probably it can lead to some reactions with the radiation therapy, and then it can lead to skin burn and lot of many problems. But otherwise, on a grosser basis, there are no such diet restrictions. You can have anything. We advise the patient just to have less oily, less spicy, take plenty of fluids, and try to untouch that particular area where we are going to have radiation. So I would not say it's a very treatment which requires a lot of stringent restrictions or a very lot of dietary restrictions. It's a very simple treatment. Only cumbersome, I would say, is that it is a treatment which cannot be completed in one day. Probably according to the stage, to the site, we decide that whether it's going to be a 1 week treatment or a 6 week treatment. So that is the only issue because there is a science behind it that you have to give it in such type of fractionation pattern. So otherwise, it's a very safe and a very simple treatment.
Okay, I must say you have given us so many valuable information today. Now I'll be asking just one last question to you. You are a frontline worker, right? So as a frontline worker, what are the COVID protocols you are taking for you and your family?
So COVID behaves same for everyone, whether it's a frontline worker or a normal person. So of course, with all the restrictions which keep on changing with time, we have followed like wearing a mask. It is just an interview, that's why like this. Otherwise, you will never see me without two masks. That's a one cotton mask and one N95. So with wearing a mask, regularly sanitizing your hands. The moment I touch any patient or any surface, I make sure that I'm sanitizing my hands and at the same time keeping social distances. But of course, when comes to a profession, whatever we have to do, we are doing. So these are the normal protocols, getting ourselves properly vaccinated. I just finished my 2 doses, even the booster, the precautionary dose. So all the COVID protocols we are following for myself, because I am a person who has to be safe enough for myself, for my family, as well as for my patients. So that's the first thing I do it for myself. Regarding the patient, we follow all the safety protocols which are required. Like the moment the patient enters in the radiation department, first we ask that it should not be a crowding. We try to segregate the patients. We try that only one patient, one relative is coming. Everybody is wearing mask. There is a sanitizer bottle which is kept at the entrance so that we can ask the patient to sanitize the hands. There is a person, security guard, who screens the patient for seeing his or her temperature. So all these protocols are well followed, which are required according to the, what we say as the mandatory COVID protocol. Same is on the radiation machine. The patient is given due respect and due social distancing protocol. And with one patient being treated, we again sanitize the machine, wait, and then we treat the another patient. So all mandatory protocols are followed so that we keep ourselves also safe, our patients also safe, and we don't carry the back infection to our homes also, because we all have family. And so every protocol is very strictly followed. We urge our patients also to go for vaccination. And as I said, radiation is a very simple treatment. So people do keep on asking me when on they are radiation, so that whether I should take the vaccine now or shall I complete the radiation. I say no, finish your vaccination schedule. So it's nothing problematic. So all I would say, all mandatory protocols we are following.
Great. Thank you so much, ma'am, for such a wonderful session. We will meet you in the next interview. If you want to book an appointment with Dr. Pooja Patel, you can book your appointment by visiting India Top Doctor's website. Thank you for watching us. We will be back next time with our new guest. Till then, stay connected with India Top Doctor for many such videos. Thank you.